عليكم ورحمة الله. صبحكم الله بالخير باللغة العربية، قنايدن باللغة التركية. أنا دكتور كوين من كوين انترناشونال جروب. إذا ما شاهدت الفيديو السابق اللي هي رحلة علاج بي، أرجع شاهد الفيديو السابق، بعدها شاهد الفيديو ده اللي هو الفيديو A. رحلة علاج لأخونا آدم جاء من السودان، كان عنده مشكلة في الركبتين وفي عظمة الورك. عنده المرض ده بيصيب الجهاز المناعي. بسبب هذا المرض حصلت له تليف أو تصلب في الركبتين وعظمة الحوض. فالحمد لله أجرى كمية من العمليات، فكانت الحمد لله كلها مكللة بالنجاح بفضل من الله وباجتهاد من تيم د.اشيش، وما ننسى كمان دكتور بيكاس أخصائي المسالك البولية، لأنه اجتهاد كبير جدا جدا في تثبيت الالتهاب الحاد اللي كان موجود عند اخونا ادم. شاهد الفيديو للنهايه. اتمنى انكم تدعمونا باللايك والشير والسبسكرايب، فعشان نتطور في القناه محتاجين لدعمكم. اذا كنت مستعجل سرع الفيديو.
Hello everyone. I am here to discuss my experience while I was treating Mr. Adam and the challenges which I faced during the treatment. This boy presented with me with a previous history of a spinal problem which has caused partial weakness of the lower limbs, and he has been bedridden for a very long time, because of which three major joints, right hip joint and both sides knee joints, got affected badly, and he came with the hope that he can be able to increase the mobility at all the three stiff joints and be able to stand and walk and do all his normal daily activities. We did the complete evaluation of the patient. We found that there was a very significant urinary infection which was present, and that had to be treated before we take up the patient for any major joint replacement surgery. So we involved our urologist also, and we found that the infection was very severe, very resistant, but with persistent effort from the urology team led by Dr. Vikas, we were able to control the urine infection very well, and the patient was suggested a small procedure also, which was explained properly, that how it's going to benefit the urine issue as well as protect any infection happening in the joint surgery which had to happen after that. Once the urine infection was controlled, then we proceeded further and started with joint by joint. We started with taking care of the right hip joint by doing the hip replacement surgery. We found that because of the long immobility, the patient, all the tissues around the joint were very stiff, they were fibrosed, and the joint surfaces articulation was very bad. But with a lot of difficulty and modifying the technique, the standard technique of joint replacement, by doing an osteotomy at early stage and doing a good liberal release of the tissues which were tight and not allowing any movement at the hip joint, we were able to achieve good reduction and a good fixation of the new implant, which was an American implant which we used for this patient. After doing the surgery, we were very careful to prevent any infection, so we always gave the patient a very high quality antibiotics. We mobilized the patient very early. We started the physiotherapy within 1 or 2 days of operation. We continued with the ice packing, and we managed the urine problem along with that. And with all the combined effort of the surgical team, nursing team, the patient and the attendant, we were able to rehabilitate the patient from the right hip problem. Thereafter, once that problem got settled, then we moved on to the knee problem, and we started with the right side, where we found the knee surfaces were completely jammed, the tissues and the ligaments were completely fibrosed. There were a lot of myositis which has developed, a lot of extra bone which was there, which has completely obliterated the joint surfaces. So we had to actually break down all those bones which were extra, and we had to clean up all the tissues. We have to open the joint gradually, and the releases were very sequential, very smoothly the procedure was done. We found a lot of challenges during the surgery because of the long standing stiffness of the joint, but at the end of the procedure we were able to achieve a mobile joint, and after the surgery, the first week was very critical because we didn't want any skin problem or dehiscence or necrosis of the skin, and we had to prevent the infection also. So we were very particular about the antibiotics, icing, early rehabilitation, and continuing the control of the urine infection. Having said that, within 2 weeks we were able to see the complete healing of the right knee joint, and patient was rehabilitated. And thereafter, waiting for few weeks, let the patient recover completely from both the joint surgery, because these were major surgeries. We ultimately moved on to the left side knee joint. Again, the similar challenge, but we were very much prepared because we had already faced the same kind of challenge on the right knee, and we were able to come out of the procedure by following the same principles of going slow, doing a liberal release, removing the extra bones, taking care of the blood vessels, not causing any complication during the procedure, and thereafter the surgery ended successfully. We had a small skin necrosis problem on the left side, but we were very watchful of every day how the dressing is moving. Even today, we are still very particular and advise some precautions to the patient and the attendant, what to do, what not to do, so that gradually the skin should heal up completely just like the normal skin, and we are able to rehabilitate the patient in a much better way. So overall, it was a very challenging case presented to us, but with the combined effort of our surgical team and a lot of patients from the patient side, because it required a lot of understanding of the disease. Being a young boy, he always wanted to, everybody wants to get up, start walking, do their daily activities, but because of chronic bedridden status, the patient mental state was also affected. So we also brought in a lot of counseling into the entire treatment, because just doing the surgery and leaving the patient would not have given us that kind of result. So we actually had a holistic approach towards the patient's treatment, which included medical care, proper counseling, early rehabilitation, medical treatment, kidney treatment, and the urine infection prevention. These were the components which we had to take care so as to achieve a final good result. So I sincerely, from my side, from the hospital side, I wish Adam a very bright future. I want him to start walking, get independent, and give his father a sigh of relief, so that he can also be proud of what all efforts he has put in for his son. It should ultimately bear good fruits. So all the very best to the family, to the patient, and I hope that we only meet as friends rather than doctor and patient in future. Thank you so much.
قبل شوية واحنا داخلين هو اللي فتح الباب، منزله لكم صورتها حتشوفوها.
د.اشيش ما شاء الله تبارك الله والحمد وشكر الله، يعني انسان بمعنى انسان، يعني ودكتور صديق هو المترجم، له الفضل الكبير، يعني ما قصر معنا.
حاجة دغري حاول.